Hi, my name is Natalie Ortman. I'm a senior health sciences major, and I will be presenting on Trump, Planned Parenthood, and the global debate on abortion. Okay, so for just a little overview, abortion is defined as the deliberate termination of human pregnancy. This is most often performed during the first 28 weeks of the pregnancy. So there are many reasons why a woman may choose to end her pregnancy with abortion. These are some of the most common. The pregnancy may be unwanted. There may be a failure in the birth control use, an inability to support or care for a child, prevention of birth of a child that may potentially have birth defects or severe medical problems, rape or incest, also conditions that could potentially endanger the woman's health if the pregnancy is continued to full term. So, regarding the issue of abortion, the global debate consists of two different sides. These are people that are pro-choice and also pro-life. On this slide, I'm going to be discussing a little bit about people who are pro-choice. These are people that believe that abortion is a right. It should not be limited by government or religious authority, and it is also believed that without this legal option, that women would resort to unsafe and illegal abortions. There are a few organizations that pursue this. These include Planned Parenthood, the National Abortion Federation, also the National Organization for Women, and these people are typically Democrat. So, in comparison to pro choice, the other side is pro life. These people believe that human life begins at fertilization, also, that abortion is killing of an innocent human being. It inflicts suffering among the unborn, and it is cruelty to couples who may not be able to conceive. Organizations that support this side are the National Right to Life Committee, Pro Life Action League, and the Catholic Church, and these people often consist of Republicans. So on this slide, I'm going to cover more of the actual debate between these two sides and the beliefs that each of them follow. For pro-choice, this includes that abortion should be a fundamental right. Life begins after a fetus becomes viable. The fetus is incapable of feeling pain up until 26 weeks of the pregnancy. Procedures, including abortion, are safe and do not cause lasting health issues. Also, this allows babies with abnormalities to not be brought to full term. In comparison, for pro-life, they believe that abortion is murder. Life begins at conception in comparison to being viable as a fetus. Also, that a fetus endures pain during the procedure. Abortions can cause physiological damage to the mother and the families that are involved. This may allow for reduction in adoptable babies, and that abortion is not a form of contraception that should be of use. So here I'm going to be talking about Planned Parenthood. To recall, they are going to be one of the organizations that does defend and take the side of pro-choice. Planned Parenthood is a nonprofit organization that provides sexual health care in the United States and also globally. Planned Parenthood also aids in contraception, family planning, and reproductive problems. They are also one of the nation's leading providers of high quality, affordable health care for women and also men. So, in regards to Trump and how he conflicts with Planned Parenthood, during Obama's presidency, there was a law passed that state and local governments were not allowed to withhold federal funding for family planning services that were related to contraception, sexually transmitted infections, fertility, pregnancy care, and breast and cervical cancer screenings from high quality health providers. This was only allowed if the providers were unable to perform covered services, also if they were not able to bill their patients for the services that they were receiving. So when Trump did become president, this was overturned and nullified. So recently he has been allowing states to deny their funding to organizations such as Planned Parenthood because of their ability to give women abortions. So as a result, if this were to continue as a decrease in funding for organizations such as Planned Parenthood. This would cause a drastic decrease in women and men's ability to receive easy health care. This would cause a rollback in access to the most effective forms of birth control. It would also cause an inaccessibility from accessing basic and preventative health care for women and men. This could potentially eliminate teen pregnancy prevention programs and also allow healthcare workers to deny information and care to women. This may also cause a decrease in the access to abortion, also potentially leading women to perform illegal, also unsafe abortions. So, for abortion as a continued global issue, there are many areas that do have a restriction of abortion. In these areas, it is found that the rate is higher of women who do continue to perform unsafe abortions, as this may also cause many health problems for the woman. An unsafe abortion is defined as the termination of a pregnancy by people lacking the necessary skills or in an environment that lacks minimum medical standards. So there may be many reasons why the availability of an abortion may be limited. This may be because of certain beliefs or laws, including religion also. So this tends to be more popularly found in countries that are underdeveloped, and this may be because of a lack of resources, people who have sufficient knowledge on how to do these procedures, also lack of family planning centers. So just a few statistics. There's an estimated of 500,000 unsafe abortions in these underdeveloped countries. Also, there's around 47,000 preventable deaths each year in these developing countries if abortions were to be allowed. So in these countries that are underdeveloped and aren't currently allowing abortions or with the sufficient information to perform these, this is extremely dangerous, and this may be because the unsafe abortion is being carried out by someone who is not qualified. Also, this area may be unsuitable for procedures like this to occur. The woman may experience infection, hemorrhage, and this may lead to death because of the lack of resources when this is being performed. So it is found that in Latin America, Africa, and Asia, there are very extremely high percentages of these unsafe abortions being performed, ranging from around 40 to 95 or 97%. That is extreme. I definitely believe that this global issue should definitely be something of focus, and I think deserves a little more attention. I think these women in underdeveloped countries do need more adequate resources to live a more adequate life. They need contraception is completely underprovided for these women. Maybe this problem would be a little more manageable if they were provided these resources. Also, some family planning services, because clearly they don't have anything to turn to, and then these unsafe abortions are occurring and killing many of these women. I think that some solutions are definitely it needs to be put in place, and this could improve the needs of many women and other families in these underdeveloped countries, or also people who are in areas that believe certain things or need to follow these certain laws. Okay, and here are my sources. Thank you for listening.